This week we have on Dr. Lila Derickson. She's a naturopathic doctor, fellow colleague, and she has a master's in integrative mental health, practicing here in Portland, Oregon. Welcome to the Herbal podcast. Very excited to have you on today.
Thank you, Bogdan, and thank you for having me. I'm really excited to be here.
Yeah, it's great to talk about the mental health of the people during this time, especially with quarantine and all the turmoil in the world leading to a lot of deterioration in mental health, specifically in feelings of isolation. So I always love having people on to talk about mental health because it is a big passion of mine in terms of my practice, but also a really important topic for the general populace, I guess, so to say. So how did you get started in this? What originally inspired you to focus in on mental health as a naturopath?
Yeah, so mental health has always been something that's interesting to me. Like even when I was younger, I was interested in psychology and sort of like the human experience. But I've had a lot of people throughout my life that struggled with mental health and have had my own experiences with it. More recently, I've been drawn to ADHD, and that is partly, kind of the same thing. A lot of folks that I know have ADHD, and I also, as an adult, was diagnosed with ADHD myself. And once I realized that, realized how much that explained, and just what a relief for me it was to get that diagnosis, and for so many of the people that I know and that I've talked to really have this framework of like, oh, okay, that's why. Like, it's not just not being able to do this thing. It's like, her brains just work differently. And then in that realization, also that kind of connects you to this neuro tribe of other people who experience the world in the same way.
As far as ADHD goes, it's pretty common. Is there any kinds of conditions or behaviors that are not understood to be as a symptom of ADHD, meaning that people can think it's just their personality or the way they are, but it's actually a symptom of ADHD?
Yeah, a lot, I think. And something that I've noticed, I think this happens with a lot of folks, but particularly with women and girls, it tends to be underdiagnosed. There's sort of this stereotype of ADHD being like the hyper boys in school who can't sit still and are disruptive. But there's also people who have the inattentive form, whether they're boys or girls or adults, that they tend to be less disruptive and are just kind of spacey and might be experiencing things like just taking a really long time to finish their schoolwork, or kind of like spacing out in the middle of conversations. And so since it's not as disruptive, it tends to be overlooked. And as adults, people with ADHD tend to be really intelligent, and they come up with lots of ways to sort of mask their symptoms or to cope with their symptoms, or drawn to careers or things that help them sort of continue to function. But that doesn't mean that it's not still stressful to get through the day, and that it doesn't take that extra effort to kind of like stay organized and do the simple things like doing the dishes or whatever day-to-day stuff just kind of keeps falling to the background.
What do you think causes ADHD? Is it something that is inborn, or is it related to environment? Is it something that could be, I guess for lack of a better term, cured, where the person could not have it? Or is it something that's almost like wired in that you at best just cope with it?
That's a really good question. And I think like many mental health things, there are a lot of different elements, the biopsychosocial realm with there does appear to be a genetic element It tends to run in families. And I do think of it as a sort of a neurological condition. Like in a way, I hesitate to call it a disorder because it's so common. It's sort of, it could be thought of as just a genetic variant. But there are also things that can make the symptoms of ADHD more challenging or more problematic. So if someone has an environment that's really not supportive, or they're often criticized or shamed for their symptoms, that can worsen just their well-being and lead to disorders like substance use disorders or anxiety and depression. And there are also other things that can happen, like people who've had concussions or TBIs, sort of long-term post-concussion syndrome can look very much like ADHD or worsen pre-existing ADHD. And additionally, a lot of times trauma can look like ADHD, and symptoms of PTSD, like inattention and difficulty with emotion regulation, can worsen symptoms of pre-existing ADHD, or can appear to be ADHD when it's, like a long-term, like complex trauma from childhood, for example.
So you mentioned some of the symptoms like inattention and difficulty with emotional regulation. What are the other telltale signs of ADHD? Because I've heard and read a little bit about ADHD, and I think I have many of the symptoms, although I never considered myself and never got diagnosed. But for the people listening, what's a telltale sign that you have ADHD versus, you're just disorganized or something as a human?
Yeah. It's one of the things with ADHD is it's kind of on a spectrum. So, according to the DSM, there's like a group of symptoms that are predominantly inattentive, and then a group that are predominantly hyperactive. And the way that they're described in the DSM is mostly describing children. And so it might be like, they don't seem to listen, or they can't seem to follow through with instructions, or have a hard time organizing and things like that in terms of inattentive. And then hyperactive tends to be like hard time staying in their seat, or fidgeting a lot, or interrupting people all the time. However, in terms of like the things that aren't in the DSM, I think of it as like a broad difficulties with executive function. So people being time blind, like not being able to either, like when you're recalling how long ago something was, just like having a really murky idea of that, or when making estimates of like how long something is going to take, being way off all the time, like consistently. Definitely the easy distraction and difficulty focusing, although people with ADHD also have an ability to hyperfocus because it's an interest-based nervous system. So for things that aren't interesting to them, that's when you see the symptoms like, I can't focus, not really sure, like I've read this page like 20 times and have no idea. But if it's something they're interested in, like a topic that they want to research, or a game that they really like, they can just focus for hours and not be aware of like anything around them. So the idea that people with ADHD can't focus is not exactly true.
That's fascinating, because what you're saying seems to be implying that it's, as you were saying, not really necessarily even a disorder, but almost a certain kinds of nervous system and or certain kind of even temperament that struggles a lot with the way the world is set up. So ADHD is most commonly diagnosed throughout the school years, right? And if anyone remembers school, it was very boring. A lot of classes were very boring. So like like the average person had difficulty paying attention. So
Mhm.
it wasn't in just, it wasn't necessarily anyone's fault. So I wonder
Yeah.
how much of ADHD is a temperamental thing that just doesn't,
Mm.
it doesn't fit into society. Like it doesn't fit to, stringent times. Like you have to be there at this time. It doesn't fit into, you got to study this or learn this, even if it has no interest, rather than
Mhm.
like, you know, having fun with your friends, learning what you want to learn.
Yeah, yeah, and I think it's exactly what you're getting at, that difficulty with regulation. So, like someone who doesn't have ADHD might still struggle to do something that's boring, but they can kind of eventually get themselves to sit down and like say like, okay, I know I don't want to do this, but I have to. It's going to be boring for a while. But someone who does have ADHD might have a much harder time and might spend like hours or days just like thinking like, I know I need to do this, why can't I get myself to do it? Like I'm sitting down, I'm looking at it, like, and I just can't get started. Or sometimes there's a difficulty with switching from one activity to another too, like just that ability to regulate the impulse and the intention of going from, here's one thing that I'm finally got myself going on and now I can't stop doing it until it's done or until like something external interrupts
Mm.
what I'm doing. And to come back around too, that you mentioned like what are some of the contributing factors and what might be a cause. There tends to be, there's an association with less dopamine in the prefrontal cortex.
Mm.
And so, that's where we get all of our executive function and impulse control for, both like planning and emotional regulation is that top down regulation. And that's one of the reasons why stimulants are so effective as a medication for ADHD is because they increase the availability of dopamine to be able to direct
Mm.
that focus and direct your activities and regulate emotions.
Because that's the case, uh, is it typical that people with ADHD use different kinds of substances, like recreational substances, as a way to cope, like caffeine, nicotine, all those kinds of things, because of how the dopamine system works?
There's definitely a correlation between there's a higher rate of substance use with people and substance use disorders with people who have ADHD, and it's partly because of that dopamine reward system, and I've heard so many times people in undergrad being, saying like, oh, I tried Adderall because my friend gave it to me or I needed to study. And everyone
Mm.
else was like high and hyper. And I just felt calm and normal for the first time.
Mm-hmm.
And so there's that of like seeking like, oh, how can I find a way to function and feel better? And there's the difficulties with impulse regulation too. So if there's the impulse to use a substance as well as that somewhat normalizing effect, as well as a higher risk of having more difficulties in society and being prone to anxiety and depression, creates kind of a perfect storm for being predisposed towards having increased
Mm-hmm.
substance use. Yeah.
That always fascinated me when I was in school and hearing that people with ADHD, they were prescribed Adderall or something and they would take it and they would actually report sometimes feeling sleepy from it, which
Mhm.
is crazy because it's such a like strong stimulant.
Yeah, and I think there's a couple of elements to that come to mind. For some people, that like having a stimulant to help them go to sleep, it sort of like calms their mind enough that they can finally relax. And then but the other thing to kind of look out for is sometimes stimulants at too high of a dose can kind of make you feel like sleepy and dizzy and just kind of numb. So I think there's like that could be a sign that it's a really great dose and a really great medication, or it could be a sign to see if maybe there's a dose that might work better and help them feel like calm and level and alert without being too sleepy or too wired.
Mm. So in current times, and especially in the past probably 2 decades or so, it's become a very common approach to give these kinds of stimulants to people with ADHD as a way of treating their symptoms, even from a
Mm-hmm.
pretty young age, when they're
Mm-hmm.
still in early school
Mm-hmm.
days. Do you think that that's effective? And um, what are some alternatives? I wanted to get into alternatives to that pathway because it seems a little bit intense to give amphetamine salts to kids. Even if it
Mm-hmm.
is kind of effective, I would suppose there's a lot of side effects with it as well.
Yeah, well, there's what I've seen in the research and what kind of the consensus is that there really isn't another medical intervention or medication intervention that's more effective than stimulants in terms of um, emotion regulation and focus. And I primarily treat adults, so I do have to give that caveat in terms of those. I I don't have a lot of experience with working with small children with ADHD, um, but in the experience that I do have prescribing, finding there are a lot of different stimulants and a lot of different formulations of them, and when you find one that works well, like ideally you'll have one that has minimal to no side effects and will just achieve that like feeling kind of like, oh, I just feel calm and focused. And if you're noticing too much appetite suppression or jitteriness or cardiovascular effects, then that is most likely not the right medication for that individual.
Mm.
Um, and and there are also there's some non-stimulant medication options like Strattera and Wellbutrin that sort of increase some of that stimulation without being an amphetamine. And there are uh, medications like guanfacine or clonidine that are really great for, like, they're more calming and they can help with sleep, and are really helpful for rejection sensitive dysphoria too, which is a part of that emotional regulation piece.
Mm.
Is a lot of people with ADHD have a tendency to or experience rejection sensitive dysphoria, which is almost like can be a debilitating response, negative emotional response to any kind of perceived rejection.
Mm.
And In terms of alternatives, there are, I think that really some of the best places to start are with lifestyle and creating structure around sleep, nutrition, and exercise. Um, and we can get into some of the other treatments like herbs and nutrients and things like that. But a lot of people with ADHD have a hard time sleeping or getting to sleep or creating structure with sleep. And so sleep deprivation has a lot of the same symptoms of
Mm.
ADHD, with like difficulty focusing, difficulty with emotion regulation, just kind of not feeling good. So that's a huge one that can make such a big impact. Um, and eating regularly throughout the day. A lot of times people will either forget to eat or eat inconsistently, um, or if they have a little bit of appetite suppression or are hyper focused with either due to medication or otherwise, then they might forget to eat throughout the day and then eat like binge at night and then have this sort of negative cycle with how they feel about food, um, and then exercise is also increases um, dopamine and norepinephrine and serotonin and all of the things that ADHD brains tend to be a little bit lower in too.
Hmm.
Yeah.
As far as herbs, I've
Mm-hmm.
heard that there's some research about green tea being very effective for people with ADHD and caffeine in general by that same stimulant theory. Is
Mm-hmm.
there any herbs that you found maybe personally effective for your patients, or just seen some research about that are good ones to start out with?
Yeah, some of the ones that I like to use are I really like rhodiola,
Mm-hmm.
which is sort of a mildly stimulating adaptogen, and I found that I think I'm personally drawn to it because I find other stimulating adaptogens like eleuthero and ginseng to be a little too stimulating for me
Mm-hmm.
personally. Um, but I, another reason that I think adaptogens are great to have on board is because of that like constant extra effort that it can take to do kind of day-to-day tasks tend to be stressful. It takes a little extra energy, and so having adaptogens on board to help cope with that I think are really really useful. Um, Another one that there's a study that I saw that compared saffron to Ritalin,
Mm.
and in terms of focus, and it was I think it was a small study with children, but in terms of focus, they saw no difference in those. So I've been starting to work that into my practice a little bit and see if that's helpful for adults. I've seen I found a supplement that has saffron, ginkgo, spearmint, and lemon balm,
Mm.
and saw some improvement with that
Mm.
with a couple of patients. So I think they included the spearmint because it has rosmarinic acid, which can be helpful for focus. Um, so yeah, and then also valerian, drop dose valerian for sensory support. A lot
Mm.
of people with ADHD have sensory sensitivity in some way, either easily distracted or irritated by sounds or bright lights or clothing that's uncomfortable. And drop dose valerian tincture in like 5 drops can actually be really helpful for sensory sensitivity.
Mm. That's interesting that saffron could be beneficial for ADHD, because I've seen some
Mm-hmm.
research of it being actually pretty effective for mild to moderate depression.
Mm-hmm.
The issue with saffron, though, that it's kind of unfortunate, is that it's really expensive for the doses that you actually need for it to be effective, at least as far as the research goes into.
Mm-hmm.
I wonder if the nervine herb class is another good option, especially for people with hyperstimulated type of ADHD, where they're like restless, anxious, that kind of thing. Like you mentioned, one of them, valerian. Um,
Yeah.
have you seen any benefit or any research about things like uh, passion flower? I know one of the formulas had lemon balm in it,
Mm-hmm.
lavender, things of herbs like that, especially in the mint family, that tend to be pretty sedating.
Yeah, yeah. I use passion flower a lot. I've given people skullcap in formulas or the encapsulated lavender extract has been really helpful for the anxiety that often shows up, which a lot of the patients that I see will say like, oh, I'm coming to you for ADHD and anxiety, and a lot of times the anxiety is secondary to like, oh, I'm not sure I'm going to be able to do this. I'm not sure I'm going to be able to make it through this conversation and focus on what the other person is saying, and so I, by like I am treating the anxiety. I usually try to target like if they are wanting stimulant medication, that can often reduce the anxiety a lot without even doing anything directly. Um, or I guess not using like just nervines, but yes, I do find that those herbs are really helpful. However, if we treat the anxiety without treating the ADHD
Mm-hmm.
or aren't adding additional supports for focus in order to sort of externalize some of that executive dysfunction or executive difficulties by like creating structure and making sure that the other foundations are taken care of, then it doesn't quite address or it's not an optimal treatment.
Yeah, that's a good point. From the traditional Western herbalist standpoint, I don't know if you're familiar with that kind of approach, but a lot of times you might not even treat the surface level organ system that's affected. So obviously the nervous system is what seems to be primarily affected by ADHD. But I wonder if different organ systems, especially when you think of them energetically, are out of balance. Like, for example, in Chinese medicine, the liver is and the gallbladder are kind of the seat of the willpower and that meaning in life and purpose. So maybe somebody with ADHD, that seems to be the fundamental imbalance, that they just feel like they're wavering in their path because they haven't found that purpose. So I wonder if for those people treating their liver specifically, or maybe their ADHD comes from their, or at least it gets exacerbated a lot by their diet and how they live. So obviously the liver detoxing that. So I like to think of things in that fashion. I don't know how familiar you are with the traditional Western herbalism system with plant energetics and things of that nature.
Yeah, I would be interested to like see a little bit more about how that would work. So I have some, or how that would work. I have some passing familiarity with some of the more energetic things, and sometimes I will talk to a patient who's like, if they're particularly drawn to a certain herb, or have more of an interest in that, like finding something that will match that energetic impulse, rather than sort of going from like, okay, symptom, and like what will
Right.
counteract
Treating
the
kind of
symptom.
holistically as
Yeah.
opposed to, this herb is good for anxiety, so I'll give that one. I think that's
Yeah.
where the medicine really shines, is when we look kind of for the deeper causes of things. You mentioned something interesting before, that trauma has a big influence on people with ADHD and may even be a causative factor. Why do you think that is? Why
Um,
trauma specifically?
mhm. Yeah, well, I think there are a lot of things that, when someone has had a really traumatic event, or time period in their life, it it really dysregulates their nervous system, and in this way that it just, their nervous system kind of gets stuck in either like hypervigilance, or downregulated, or any kind of variation of that. And so I think that it can be a contributor to symptoms of ADHD, in the sense that if someone is already predisposed or already has ADHD and then experiences trauma, or even the trauma of chronic rejection and shame from having ADHD and not having it be recognized, then that exacerbates the dysregulation, and contributes to the symptoms of being overwhelmed by emotion, or memories, and just having a hard time kind of staying present. And I've seen a lot of people who've had trauma that, like, I think that what we're working with is PTSD, and there's just so much of an overlap of some of the symptoms, with like memory challenges, the ability to regulate emotion, the ability to remember like now versus not now, like when you're having a flashback or a memory, or frustrated by something in the moment, remembering that there are other times and that this will pass. And that kind of being overwhelmed by the present moment can happen with both ADHD and PTSD.
Yeah, that's the interesting thing about trauma, is that it seems like these events happen and there's a kind of imprinting in a sense on the nervous system. And many of the symptoms that manifest are kind of the adaptations to that life at that period of time. But as life continues, they kind of get in the way. So something like ADHD, maybe early trauma leads to them just kind of being generally dissociated from what's going on and easily distractible, because that was maybe a great way for them not to experience the pain of their situation, is to be distracted or not pay attention to it directly. So it
Mhm.
becomes almost like a temperamental trait.
Yeah, I think, I'm hesitant to say that trauma causes ADHD. I think there are times like where they're present, it's likely that ADHD was there, and like that is part of how the nervous system is wired. And
Mm-hmm.
then with the additive effect of trauma or the unsupportive environment, and not having, you know, already having challenges with coping and planning, and then having on top of that this really traumatic influence, sort of just makes it harder to find that regulation or even know what that regulation feels like in oneself. And with, with complex trauma or challenging childhood environments, we really need to have, like, we learn everything by example. And so if there's no one around who has a regulated nervous system, and we're already predisposed to having a dysregulated nervous system, or a nervous system that's really hard to regulate, then that can certainly have an additive effect.
What are some things that people with ADHD can do to in their lives to mitigate some of the symptoms, specifically their level of attention, their ability to kind of follow through on tasks? What are some practices that could be done, let's say?
Yeah, I think first of all, I think having some self compassion of like, there are going to be some times that are easier than others to focus and engage, and having some flexibility with yourself as much as possible. But also creating, I think one of the biggest things is creating structure. So having the same time that you have meals every day, or the same time that you go to sleep every day, and also finding ways that that you can make things urgent or interesting or challenging in some way. So one of the techniques that people use, like, I think on the Reddit or internet, they were talking about like the Pomodoro Technique, which is
Mm-hmm.
basically like setting yourself a timer and being like, I'm just going to work on this for however long, and then that's it. And so sort of creating that structure of something that's really circumscribed, and like, okay, I've got to get as much as I can done here. And also going easy on yourself, because people with ADHD tend to really be over ambitious with, like, they'll make a to-do list that's like got like 50 things on it, and then feel really bad when they only get 2 things done. But in reality, like, it's not humanly possible to get that many things done in a day. So kind of like celebrating what you do get done.
Mm-hmm.
And I think the other thing that comes to mind is, if there's someone that can be your body double, so to speak. So if you have someone in your household that can just sit with you while you're working on something, or work on something on their own, or if you don't have someone in your immediate household, having someone on Zoom, or like some kind of virtual just presence, be like, okay, there's someone else here. And sometimes just having the presence of another person can really help with getting through that feeling of stuckness, and getting through that feeling of not being able to start.
From some of the solutions you talked about, it makes me think a lot of the system of energetics of Ayurveda, and the
Hmm.
fact that there's kind of 3 constitutional types. So there's the Vata, Pitta, and Kapha. Kapha is kind of like the bigger set, slow, sluggish type. Vata is very nervous system active. very, like mood shifting. And Pitta is more like ambitious, aggressive, that kind of personality type, just in their super basis. But a lot of the things that seem to occur with ADHD, like lack of focus, irregular schedule, these kind of things are classic constitutional characteristic of the Vata type.
Mm-hmm.
And the actual treatments in Ayurveda for that type are regular meals, regular sleep, uh, things of that nature, things like warming herbs, because it
Mm-hmm.
tends to be a very cold type of constitution, things that calm down the nervous system. So a lot of the sedative herbs are used for it. So I wonder
Mm-hmm.
if in that system, they might even just call it like a very extreme imbalance of a natural constitutional type where that person is just wired in a certain way. And when their environment, their lifestyle, diet are out of whack, then it gets so exacerbated that it becomes kind of this disorder of ADHD.
Mm-hmm. That's interesting, and I think that it's kind of neat to hear kind of like the parallels of how we think about it and structure and things to help support that. Um, and it kind of reminds me of bringing it back to the idea of like maybe it's not a disorder, it's just like the way that the world is organized is not particularly helpful
Mm-hmm.
for that type of nervous system.
Right. And how did it survive for so long, right? Through evolution. I mean, obviously, that type of person, if it is genetic at all, that it was beneficial to be that type of person in certain societies and events and whatever. Maybe they were really good at finding like things in the forest because they were always like their attention was everywhere or something like
Mm-hmm.
that. Or maybe they were really good at becoming super specialists in a certain category because as you were mentioning about people with ADHD, when they find something they're really interested in, they kind of seem to get like obsessed about it, where other
Mm-hmm.
people won't have that level of focus.
Yeah, and I think there are actually a lot of strengths to that even in present day society that are really helpful. Like people with ADHD tend to be really creative and be able to think outside of the box and are often artistically talented and do have the as you're saying, like with that hyper focus superpower, when there's something that really hooks their interest, they can really just like dive into it and make projects or breakthroughs or just something that's really personally satisfying when they're able to sort of
Mhm.
harness that.
I think that's an empowering viewpoint too, to not think of it as all bad, but as a just unique thing that has its goods and bads that just needs to kind of be balanced and understood as not something being wrong with that person, but as just something that is unique about them, that could be a strength.
Yeah, and I just want to add, like a lot of the symptoms or things that people come in for treatment for are more related to where ADHD meets society and has a hard time meeting those demands, and not due to the symptoms themselves.
Mm,
Like being able to, if they have the flexibility to sort of like wander off and not do what they're supposed to be doing right at that moment, but wait until they have enough interest or urgency to do that, then it's not really a problem that they can't do it right then. But if they don't have that flexibility and they're overwhelmed or distracted because of the clock ticking or the fluorescent lights buzzing, then that's when it becomes an issue. So it's
mm,
really a lot of it is, I think, the environment and the lack of recognition and the way that people are shamed or taught like, oh, just try harder, rather than finding a way to make the environment supportive for them.
mm. That's a good point that you bring up, that it's the symptoms in and of themselves are not necessarily so negatively experienced.
Mm-hmm.
Um, in fact, I bet to somebody with ADHD when they're trying to learn something boring and they just can't do it, they're like, well, it's just because it's boring. Why would I even care about learning about this? And when they find something interesting, they're obsessed about it. And obviously that's like a very positive experience. But as you
Mm-hmm.
say, when it meets like relationships or jobs and work responsibilities, then it starts becoming like this conflict where they can't really adapt to the world that they live in.
Yeah, or the world doesn't know how to adapt to them, and isn't there's just a kind of a lack of communication, a lack of mutual support in a lot of situations.
What kind of career paths do you think would be good for people with ADHD?
I think there's probably that varies pretty widely, but obviously if there's something that someone finds personally interesting, but also on like something like entrepreneurship could be, since there's a lot of change and a lot of different things that can be focused on, that could be a good thing. And yeah, there are, depending on kind of your personality and interests, doing something in the creative field, whether it be like art or some kind of design. Sometimes people with ADHD do really well with deadlines. So like, something where that's like project based. On the other hand, for me, part of the reason why I started my own practice is because I really need flexibility and being able to have flexibility in my schedule and being able to rest when I'm feeling overwhelmed or exhausted, but still having the structure of the business and being able to interact with people and sort of like have that balance. So yeah, there are a lot of successful people who are like CEOs and doctors and artists, and it's really, really across the spectrum. So kind of hard. I feel like it's kind of a hard question to answer, but I guess those are a couple of the elements that come to mind.
I would think there's like a answer for things that they shouldn't do, like a 9 to 5 job that they hate is probably going to be much harder for them than it is for another person to kind of just grind through it. So at least that. As far as so with a lot of these psychological conditions, there's questionnaires that you answer questions and it tells you what's your likelihood and severity. Is there one for ADHD, like some questionnaire that you can like look up like to score how bad your symptoms are, or if you're just having, that's just your experience but you don't actually have ADHD in any real form?
I think that so one of the more common like kind of primary care screeners is the ASRS. And that's just kind of a short one-page screener. I also have, there are a lot of articles on the internet that, like, I have no affiliation with the Adhd magazine, but attitude.org has some good ones, and like they've got some articles like what does ADHD look like in women, and like adult ADHD versus like the criteria for children, and so I think resources like that are great to look into. There's also in terms of diagnosis from a clinical standpoint, the DIVA 2.0 questionnaire is a sort of a structured clinical interview that if you suspect one of your patients has ADHD and you feel comfortable evaluating them, that's a good standardized questionnaire that you can use as a guideline.
Yeah, I'm asking you because I actually want to look into it and see how I score on these tests. Because based on everything you said, I'm pretty sure I have ADHD and have my whole life, but I just never really went to get it diagnosed. So that's good to know.
Yeah.
So I wanted to zoom out a little bit. We've been talking a lot about ADHD, which is awesome. What do you think is the role of a naturopathic doctor or physician in mental health? So being that we're both naturopathic doctors that focus on mental health, we're obviously different in some way than other naturopathic doctors because we have that kind of specialty, and also different than the conventional model and psychologists and that kind of thing. What's our role in the healthcare system for mental health?
Yeah, I think that since we have training in or the holistic approach is really focused on mind-body medicine, I think we have a really unique opportunity to bring that to patients. And in thinking about exploring like, oh, how do I fit into the sort of like medical landscape? I do feel like we're sort of a blend of being able to do some counseling and being able to do prescribing and being able to do the foundational work of mind body medicine and looking at ways you can support the whole system. I think that that's really a strength. And that being said, I also have some reservations about, I do think that additional study and additional education in mental health is really important for naturopathic doctors due to like some of the like we don't have a lot of really good training, at least when I was in school. I feel like the training that I received from the naturopathic side was great for kind of like just sort of basic making sure doing no harm and things like that. But I feel like more in-depth mental health training, like in the integrative mental health program or through residency or clinical rotations, were really vital for me for rounding out my skills in mental health.
Mm-hmm. Yeah, I completely agree with you. I think naturopaths we're unique because we can do kind of so many things. We're, in a sense, a jack of all trades. And I guess the difficulty with that is really being good, like a master at a few of the things. But in terms of mental health, I think we're really well suited, especially as you mentioned, if we get additional training, through apprenticeship, self-study, whatever, learning, more about the mental health sphere. And there's plenty to learn about psychology. You can learn, I'm particularly fond of Carl Jung's methods, psychotherapy methods, and dream interpretation. And that's kind of like the tradition that I went to. But there's a lot of information out there. And this day and age, I don't even think you can learn so much on your own from like the internet research, from reading books and studying them, that you can really do that. But going back to the original point, as naturopaths, we can deal with all the aspects of somebody's life, and obviously all the aspects affect mental health. So dealing with somebody's diet, which has a big influence, dealing with their lifestyle, their exercise has a big influence, dealing with, just basic issues that they have in their life, the counseling aspect, dealing with maybe the case is so intense or it's so debilitating that you kind of need a temporary pharmaceutical to kind of level out so that you could do more work. And then doing the kind of holistic approach of herbs and supplements and all that kind of thing. And we can kind of do all that stuff. So that's really, really kind of beneficial, because if you go to a psychiatrist, you might get, psychotherapy and a pharmaceutical. If you go to an MD, you're probably just going to get a pharmaceutical and not much else. If you go to a psychologist, you're just going to get counseling. So we can kind of do a lot of the things depending on our specialty. So I think that we're very uniquely suited to it. And I also find that a lot of the people that come to naturopaths are wanting that kind of service, because in the conventional system, it is so disregarded. Like in a lot of the conventional medical system, if you tell your doc that you are feeling anxious, they'll give you a questionnaire and they'll prescribe something for you. And they just don't have enough time to ask you, like what happened when you were 3 years old. That's like a whole visit in and of itself.
Yeah. And even when you do have that, that insight and that training and ability, that's still a lot for one person to do. And, I'm finding that a lot of times if I have patients who, especially if it's a complex case, I really do enjoy working in a team and being able to, maybe do some counseling and some prescribing in naturopathic medicine, and then have them also have a therapist that they're seeing that I can kind of like, stay on the same page with and kind of reinforce what they're working on with their therapist if that comes up. Because it's really, we're very complex beings, and it takes a long time for, especially with like counseling work and deep work, it takes a really long time to sort of have that heal and have that start to shift. And if there's, especially like now with all that's going on in the world, if someone comes in every week and you're just putting out a fire every week because everything is just constantly feeling like too much, being able to work in a team or someone that can sort of give them the types of support that gives you enough space to really work on things in the visit.
Great point. Yeah, I highly agree. Naturopaths are particularly well suited to be part of a integrative team, just because we do have so much exposure of the other fields, which I think is important to understand, like what the people you're working with, strengths and weaknesses are, and what they can and can't do, so that you can kind of be like, in a team, you could be the person who kind of figures out like where to allot everyone. Like, do they go to this counselor? Do they go to this massage therapist? So I think that puts us in a really good role just with our overview of the fields. So yeah, it's a pretty good time. I know the Association for Naturopathic Psychiatrists is making a lot of big movements these days, trying to get board examination for psychiatry/psychology for naturopaths. So I'm looking forward to that, and all the people who want to focus in mental health, because that's been kind of my passion since since I was still in like college. So, and I kind of just found this was the route that I took to do it.
Yeah. Yeah, I think it's interesting how that path to what you want to do a lot of times ends up being very meandering, and I feel like that happens with naturopaths a lot.
It might be ADHD too.
Yeah.
But yeah, like I honestly don't regret it, because I think like if I had gone earlier in my life, so I studied philosophy when I was in school. I was considering kind of just going straight into psychology. But like after I've had the overview and all the medical education and then all the self-study, I actually, in some ways, I feel like I wouldn't have known like the impact of just the biological and physiological aspects of mental health, which I think are super important to appreciate along with the psychological. So I think that it's really good to understand both, because sometimes it's just because they eat McDonald's 3 times a day. I mean, like how happy can you be if you eat junk food all day long? Like your body is just under so much stress from that it's like, it's hard to be in a positive mood. So there's obviously physiological factors that impact mental health. So I think that they're super important to count in.
Yeah, and I think it's an interesting thing that you bring up with fast food and diet, and that's certainly something that I've had quite a journey with, both personally and in terms of just my overall clinical journey with disordered eating and mental health. And I kind of started out with very, often recommending, like feeling like there was a perfect diet and recommending like, oh, this is how you eat a whole foods diet. And I certainly think that whole foods are important. But there's so much in with like diet culture and extremes, like, with a lot of times people will go to a doctor or a medical practitioner and say like, oh, what should I eat? And they say, eat more vegetables. And then the person like goes into full blown keto or like full blown, some really restrictive diet that ends up being harmful in some ways, or they end up skipping meals. And I've actually seen in my approach, I've started just saying like, let's just start with getting you eating throughout the day. Like, just like, let's create a schedule where you can have like 3 meals a day, and not be skipping meals. And find that just with that, people feel so much more regulated mood-wise. They have much lower anxiety. They can concentrate better. They aren't having cravings for like eating massive amounts of sugar at the end of the day because their bodies are telling them that they're starving and they need to do something about it. And from there, it's sort of, just encouraging, okay, like eat what you want and incorporate some variety, like incorporate a vegetable every now and then. And sort of with taking that intuitive eating approach and like really telling people that it's okay to eat. Like so many people feel like they can't eat, like they have to starve themselves all day. Then yeah, getting in touch with that intuitive eating and what your body's signals are already telling you, I think is a really healthy way to come back to come back to your relationship with food.
Yeah, and I've noticed a lot in patients that uh, the stringency of diets has a lot of negative psychological effects.
Mm-hmm.
Like they'll, eat something that they're not supposed to eat because, whoever told them that, God forbid you eat a tomato, and they'll feel
Mm-hmm.
really, really bad about themselves.
Yeah.
And I'm almost like 100% sure that just the feeling of really bad and stress is worse than like the donut that they ate. Like I
Mm-hmm.
think the fact that they
I agree.
they like just canceled all their plans that day because they ate a donut and felt so bad about themselves is probably
Yeah.
way more harmful. Like, so I think that a conversation around um, not like eating unhealthily in a sense,
Mm-hmm.
but in being aware that you're going to slip and it's okay and it's part of the process, no big deal. Like it's what you eat regularly that matters, not what you eat one day, not what you eat 2 days. It's your general diet that has the most effect, not, the off slice of cake that you eat and you don't have to beat yourself up over it. I think that's a really important point too, as you were kind of
Yeah.
talking about.
Yeah, exactly. And it's about like eating some vegetables and like some form of balance. And
Do what you can.
yeah, and if you're feeling like you can't have a dessert with your, in a social setting, then like that social connection is just as important as nutrients, like and nourishment, and it's a form of nourishment in itself. Um, so yeah, I think it's really helpful to have a moderate stance in that. And of course I'm not talking about like people with celiac disease who will like, get very sick if they eat. I'm not saying like, oh, if you have celiac disease, it's okay to
Yeah.
like definitely not. But in terms of like general dietary recommendations for people who don't have serious medical conditions
Mm-hmm.
that preclude certain foods.
Yeah, and I like the point you bring up about there isn't like any one ideal diet that fits everybody, and kind of going back to the Ayurveda way of looking at diet. Like the types that typically would have mental types of issues like anxiety, especially ADHD, the Vata type I was talking about, which is that kind of thin, like nervous system's very overactive type of person.
Mm-hmm.
They're actually not recommended to eat raw vegetables at all. They're supposed
Mm-hmm.
to only eat like cooked vegetables and things that are really like warm. And they're not really supposed to do like intermittent fasting or long-term fasting because that increases that vata energy. So like
Mm-hmm.
those general like health advice, like there's so much research about intermittent fasting being great, about raw food diets being great, but they don't necessarily apply to everyone at all times. So I think that that's important to view the person holistically, and not
Mm-hmm.
just think that because the research says that intermittent fasting is great, that everyone should always do it. I think it has to
Yeah.
be in place.
Yeah, and I think one of the principles of naturopathic medicine is that like the healing power of nature, and that the organism will naturally tend towards health given the right resources and
Mm-hmm.
and removal of obstacles. And I really believe that extends to nutrition. And if you can help someone connect with their internal cues for eating and food and what kinds of things they're craving, and also addressing any emotional story, that because we all have an emotional story about food too, and really increasing the availability of variety as much as possible. Like if, if there isn't, if you don't have foods rich in certain nutrients, then you're probably not, it's not going to occur to you to eat them. But yeah, I think that it's our responsibility to help people connect with their own internal healing wisdom in terms of nutrition.
Mm-hmm.
And it can be a long and challenging journey. Like a lot of people have had such a challenging relationship with food that they really have no idea where to start, and they do need that support of like, okay, this is what it feels like, or that this is hunger. You actually, it's not, there are hunger cues before the point where you feel like you're about to pass out and your stomach is audibly growling. Like there are points before that let's figure out how to listen to those and things like that.
Yeah, I think that's super important with all the just general ideas about diet, especially even within the natural health type of spheres where
Mm-hmm.
there's a lot of extremism actually, I would say,
Mm-hmm.
like intense juice fasts and um, those kind of things, like very long-term fasts, which I think could be amazing for certain things, but aren't like a one size fits all. And I think even the aspect you brought up of the person's diet, how it relates to their social and family and friend life, like if they're just not going out for pizza and they don't have celiacs because they're afraid of eating pizza, whereas like overall maybe the health benefit of just being with their close friends would have been better, or maybe they feel weird because they eat different stuff than people around them and people kind of look at them. So
Mm-hmm.
there's so much to it, and I think that's why you should go see a naturopathic doctor, because we deal with all those things at the same time. Shameless
Mm-hmm.
self plug. Um, so I want to finish off with a question.
Mm-hmm.
Are you familiar with Measure 109?
Can you remind me what it is? I think I
Yeah.
know what you're
So
about to
Measure
say.
109 just passed a few days ago, and it allows psilocybin to be used
Mm-hmm.
as a medical therapy by
Mm-hmm.
certain trained licensed facilitators. They're still working out specific details of what that means. I
Mm-hmm.
wanted to ask you what you thought about that, considering that it is such a really a mental health therapy is what it is.
Mm-hmm. Yeah, I think that is really interesting, and I think it has the potential of being really helpful for a lot of people. I'm curious about what kinds of structure and certification
Mm-hmm.
that they're going to be implementing. Um, the the effects of psilocybin have, a lot of potential for helping people feel a sense of connection and like ease and a sense of oneness. And so I think that could be really helpful for a lot of mental health conditions. And there's also, as with any psychedelic, it's not something that I would recommend for someone who's had psychosis, for example, because um, someone who is in acute crisis. Like a lot of times, that can be potentially triggering for folks, and so yeah, as with any medicine, especially with powerful medicines, I think that done well and conscientiously with trained people who are trained in it, there's a lot of potential
Mm-hmm.
for healing there.
Mm-hmm. And I'm interested too to see how they work out the specifics here in Oregon,
Mm-hmm.
um, because as you said, it could have great benefit for, especially kind of the typical malaise of civilization, the kind of anxiety and depression that most people feel more or
Mm-hmm.
less most of the time. I think that like it's particularly great for that because it, as you were mentioning, that feeling of oneness, it also gives a sense of deeper meanings in life, which is usually what
Mm-hmm.
people who are suffering from a lack of meaning in their life need. Obviously, meaning, a
Mm-hmm.
sense that there's something greater than them, new ideas for how to approach their life. So I think it's a great benefit, but then also of great danger if used kind of very wild west style, especially with
Mm-hmm.
people with uh, maybe family histories of schizophrenia or past psychosis, as you mentioned, because it is really strong, and it is a strong stressor on the mind, the psyche, and the nervous system. So certain people might be worse off because of it than others. I still think that's probably going to be more rare than like just generally okay effects from it, or very positive effects from it. But I worry about if they, depending on how they actually go about enacting the use of this and what they call like a practitioner, or what the kind of training they have to go to, because if there are severe bad events with just one person or two people, that the whole show might close, and that would be very, very upsetting, because this is such a kind of big move forward, I think, for mental health therapies, because in my personal opinion and experience, those therapies used properly with the proper setting, proper dosage, proper screening, can be, some of the most pivotal kinds of treatments that you can do for mental health, or really more for spiritual health too, just something even beyond just mental health. So I hope that all works out. I'm definitely planning on doing it if I possibly can. So we'll see what happens.
Yeah. And my hope would be that they would have, and I'm sure they'll come up with like some kind of screening criteria to sort of look out for some of those things that we were talking about that could potentially go awry.
Right.
So, yeah.
Right. And I think it's important to always keep in mind that people have been using it before it was legalized medically. So hopefully that this just leads to more safety, if anything. I can't see it leading to more harm. If anything, it should be more safe now. But, well, I guess we'll see, as with all things. This is very experimental. I think, I guess, is it, I think Colorado has it decriminalized. But I think Oregon's the first state that has it legalized for actual medical usage in a sense. Maybe even in the whole world. I'm not sure about that. I know other countries have recreational, but I don't know if they have like medicinal usage of it.
And I think it's going to be another couple of years before we actually see it implemented and how the programs are going to unfold. But it's an exciting first step. I'm very curious to see how it comes about.
Me too. Yeah. In the law, they basically said that it will be implemented over the next 2 years. So it's sooner rather than later, hopefully.
Yeah.
Well, Dr. Derickson, thank you for being on the show. This is the Herbal Hour podcast. Where can people find your clinic, your work, what you're up to?
Yeah, you can find me. My clinic website is shelteringoakclinic.com. And I'm also on Instagram and Facebook at Dr. Derickson. Doctor is spelled out. And I'm currently accepting new patients virtually. So you can just contact me through one of those spots if you're interested in finding out how to make an appointment.
Awesome. Sounds good. And if you guys are watching this on YouTube, subscribe. And also, if you want to visit the website directly, it's herbalhourpodcast.com. We're on iTunes, Spotify, all the places. So be sure to subscribe to us if you love learning about natural health. And that's all. Thank you for joining us.
All right, thank you so much.